Pregnancy and lactation are nutrient marathons, not casual jogs. Every vitamin and mineral suddenly matters more, not just for mom's energy and immune resilience, but for the small, rapidly developing human who's literally borrowing her body to grow a brain, a spine, a nervous system, and an immune plan for life. One such mineral that deserves more respect during this critical time?
Zinc.
Zinc may not get the same glow-up as folic acid or iron in pregnancy brochures, but it absolutely deserves a spot at the front of the prenatal nutrition line. It plays a fundamental role in DNA synthesis, cell division, and protein production, which, let's be honest, are happening at a borderline miraculous rate during fetal development. It's also key for neural development, helping shape the baby's brain, spinal cord, and even early learning capacity down the line. If you're growing a baby, zinc isn't optional, it's foundational. But that's just the start. Zinc is also essential for shaping a newborn's immune system. The thymus gland, basically baby's immune HQ, depends on adequate zinc to produce T cells, the white blood cells responsible for identifying and neutralizing threats. When maternal zinc is low, studies have shown that infants may have delayed immune maturation, making them more vulnerable to infections in the first critical months of life. So while zinc won't replace vaccines or hand washing, it does help build the internal defenses that newborns need to survive and thrive in a germ-filled world. Zinc's role doesn't stop once the baby is born. During lactation, zinc is secreted into breast milk to support ongoing growth and immune development. And get this, the zinc content of breast milk is not fixed. It depends heavily on maternal zinc status. If mom's stores are depleted or her diet lacks bioavailable zinc, especially likely in vegan or vegetarian diets, the concentration in milk may fall below optimal levels, which can impair growth and immune function in the baby, particularly if breastfeeding is exclusive. Now, you might be wondering, aren't all prenatal vitamins already loaded with zinc? Not quite. While many do include it, the amounts can vary, and they often hover around 11 to 15 milligrams per day, enough for most women, but potentially not sufficient for those with additional risk factors, such as high phytate intake, digestive issues, or multiple pregnancies close together. The recommended dietary allowance, RDA, during pregnancy is 11 milligrams per day and 12 milligrams during lactation, but remember, these are minimums, not perfect targets for every individual. Some women may need more, especially if their diets are heavy in whole grains and legumes, which contain phytates that block zinc absorption, or if they have conditions like inflammatory bowel disease or gestational diabetes, which increase the need. Too much zinc, however, isn't the answer either. Megadosing is not better. Doses above 40 milligrams per day, the tolerable upper limit, can interfere with copper absorption and cause nausea or GI distress, two things most pregnant women are already trying to avoid. The goal is balance, not excess. The best approach? First, eat zinc-rich foods, meat, shellfish, well cooked during pregnancy, eggs, dairy, seeds, and fortified grains. Then, choose a prenatal that includes at least 10 to 15 milligrams of zinc, ideally in a well-absorbed form like zinc citrate or picolinate. And finally, if your diet is restricted or you've had deficiencies in the past, talk to your healthcare provider about bumping your intake just slightly above baseline. Nothing heroic, just enough to cover your bases during this very biologically demanding time. Zinc might not be the most glamorous prenatal nutrient, but it's a quiet powerhouse. It helps build brains, calibrate immune systems, and ensure that both mom and baby are equipped for the physiological high-wire act of pregnancy, birth, and breastfeeding. So whether you're sipping smoothies, juggling supplements, or just trying to keep toast down, don't forget the zinc. It's small, it's mighty, and during pregnancy, it's doing a whole lot more than you think.